Can you tell me a little bit about yourself?
My name's Paul Molloy. I'm a GP. I work in a practice called Clarendon Medical. It's situated in Northland Avenue in Derry, just beside Radio Foyle. We have 6 other doctors working in the practice, and we have a practice that looks after just over 11,000 patients, so quite a proportion of the population of the city side. Our practice basically covers Craigan, Rosemount, the Bogside, large areas, other areas of Derry, down as far as Culmore, out as far as Drumahoe, and out as far as New Buildings. And we have people of all ages and people of all backgrounds registered in the practice. My job as a full-time GP. I'm also a thing called the local medical committee secretary. I am employed on a part-time basis by the British Medical Association to look after the welfare of general practitioners. That's how I became involved in the setting up of the COVID Centre in Derry. The COVID Centre was set up in conjunction with the Western Trust, with the help of GPs who obviously staff the site with nurses and cleaners and nursing assistants and other people. And we started talking about setting it up approximately a month ago. There are 2 COVID centres in the west. There's one in Altnagelvin Hospital, the other is in the Southwest Acute Hospital in Enniskillen. Basically what happens is that whenever you phone your GP, instead of going to your GP surgery and being seen there, all patients who possibly have coronavirus are seen at Altnagelvin. So your GP takes a good history of you, and then if he feels you need to go to the COVID centre, he arranges an appointment, or he or she arranges an appointment for you to attend the COVID centre. In the COVID centre, the doctor will see you and decide whether you need to be kept in hospital or just need treatment and sent home. The vast majority of patients we see in the COVID centre aren't kept in hospital. The vast majority of people are given antibiotics or treated for probably other conditions and sent home. It's a very small proportion of people are admitted to one of the wards in Altnagelvin where they're given, other treatments, and a very, very small proportion of people altogether end up with going to intensive care and needing ventilators, and an even smaller proportion than that of that small group ultimately don't get out of hospital, unfortunately, and die.
What is it like working in the COVID-19 ward in Altnagelvin?
Working in the COVID centre is actually quite nice. It's very safe. We have plenty of personal protection equipment. The nurses are very organised. Patients are brought in a very safe manner. Patients know what to expect when they arrive. They're brought into a room. A nurse comes in and does their observations, checks their pulse, blood pressure, etc. Then a doctor comes in and has a quick check of the patient and decides what to do. The patients are then either sent home as stated earlier or moved to the hospital, and then that makes room for another patient to come in. Between patients, obviously, there's a particular group of staff who clean the room and make sure that there's no virus present on any of the surfaces or on any of the equipment that we use, so that it's not spread to another person.
How can people stay safe also while reducing the spread of the virus?
How can people stay safe and reduce the risk? Well, to be fair, the only absolute answer to avoiding catching coronavirus is not to leave the house. If you are currently at home and you're sticking to the government guidelines of not going anywhere further than a few miles of your home, and you only go if you need groceries or shopping, then you're probably less likely to catch coronavirus, because if anything, there's probably a lot more chance of me catching coronavirus if I go to the shop than there is in the COVID centre, because in the COVID centre everybody's wearing protective equipment and everything's cleaned, whereas in the shop, very likely to meet somebody who doesn't even know they have coronavirus and is asymptomatic as a carrier, and those are the type of people you worry about picking it up from. So if you want to be 100% safe about not getting coronavirus, you really have to stay in the house and stick to the rules as per the government. Luckily for you, young people are probably slightly less at risk from coronavirus. You'll have seen and read the statistics that it does seem to be an illness that affects elderly people more, and that's because elderly people have other significant problems like chronic obstructive airways disease or heart disease, and it's the cumulative effect of more than one illness that makes it difficult for people to fight off the illness. So if you have a good, strong immune system and you're young, the chances of you coming to any great harm are a lot less. So if I was this particular group, I wouldn't worry overly about coming to any great harm from coronavirus. But what you would be worried about is that if you go out and don't stick to the rules regarding meeting your friends and going to parties, etc., you could spread the illness, because young people like yourselves can get coronavirus and not even know you have it, or have something like a simple sore throat or a sore, chesty cough, but something like you would get just with a normal flu or cold. But the problem is that if you meet your mum or your elderly granny or somebody like that, that if you pass it on to them, because they're in the group of people who are more prone to serious outcomes from having coronavirus, then obviously you would have been the one that would have passed it on to them. So while young people aren't at the same risk, they are probably the biggest group who would be likely to pass it on, because as we've seen from all our families and probably your own families, elderly people, grandparents, people that are sick have been very good at staying in and not going out, and you probably all have somebody who you're taking groceries to or helping or contacting them on Face Talk or whatever these video things that you use are. So these are the sort of people that we're talking about. So the best and safest thing to do is just stick to the rules as per the government.
In your own opinion, how long do you think this lockdown will last?
How long will the lockdown last? It's very difficult to say. The lockdown in its current guise will probably go on for a while until the government decide how we're going to slightly relax it. And as stated, it probably will be the younger group of people, probably people who need to boost the economy again. Like we've seen some of the construction staff back working this week. Maybe some shops that currently aren't open. But it's a very fine balancing act, because essentially if you can maintain lockdown the way it is at present, it minimises the number of people who'll get coronavirus and who'll pass it on. However, we have to balance that up against the need to maintain the economy, and there are groups of people out there who have lost their jobs, and our families are struggling, and obviously it's easy for me as a doctor who's still getting paid to say that we should maintain a lockdown, but if I was perhaps had a job where I wasn't able to work and my family were struggling, perhaps I would feel slightly different. So I think those things have to be taken into consideration. But the absolute answer is, if the lockdown should last until we have a safe vaccination, or at least until we have a medication like Tamiflu. Tamiflu is an antiviral treatment. The best way to describe it's like an antibiotic that you can use if you have the flu, and it fights the virus. And they are trying to develop a similar drug to Tamiflu for coronavirus, and it's probably likely it'll be ready before any vaccine. But essentially, you'd want to maintain a reasonable lockdown until you either have the vaccine or have the antiviral treatment. So I would have thought that for anybody who has severe heart disease, severe chronic bronchitis, anybody who's very elderly, it's probably likely for those people that the lockdown will be maintained or recommended until these treatments become available. So that's probably not good news for our elderly relatives and friends. And then that means that for young people like yourselves, again, it's imperative that you don't be bringing the virus into them, especially if you don't even know that you have it. And we were talking earlier about the vast majority of people who get coronavirus probably won't know that they have it, or only have very mild symptoms, and these are where the risks come in. But as regards when this current lockdown will end, I personally feel it's probably going to be within the next few weeks, and it'll be not a complete relaxation, but sort of a very gradual relaxation, and only some businesses will reopen.
Will I be able to go back to school before summer?
I don't think you'll be back to school before the summer. That's my own personal opinion. There's been lots of different talk about whether schools should go back or not, and if you think about it, if you think what we were saying earlier about carrier status and young people perhaps not being overly affected as regards symptoms, but passing the virus between each other and to other people, then obviously the more young people who get together, like at school, the higher the chance of the virus passing between those people. And while the young people themselves might not get that particularly unwell, they could pass it on to elderly people if they aren't particularly careful. So my own thoughts would be probably not until September, and even then there might be particular rules around numbers attending school, but again, those aren't the decisions for me to make. Unfortunately, those are for the government, and to be honest, I do feel sorry because they're particularly just difficult decisions that they're going to have to make.
What inspired you to help our community during this difficult time?
What inspires me to help my community? I don't know. Probably the fact that I'm a GP already, and the fact that over the years I've just assumed responsibility whenever particular things like this have arisen. Probably comes partly with my job as being a GP, being responsible for people in the community, and also that I have a role, obviously, as a leading other GPs via my British Medical Association local medical committee role. So it's probably something that I've just sort of moved into. I haven't thought an awful lot about, and that's probably the way most of us end up in particular jobs. I don't feel as if I'm doing anything extraordinary. I think that's just, I mean, it's really just part of my job, and I think you probably find too that if you look around, there's people doing a lot more than me. People in the communities making PPE, helping the elderly people, trying to call with people who are getting lonely. So there's a lot more people out there doing stuff than me, and I think we probably should all try and do that a wee bit more during these particular times to try and help someone. And if you get any inspiration from me at all, then I'm very glad that you asked the questions. I'd be very happy to speak at any time in the future. And also, I mean, remind people that any particular career in health sciences, such as nursing or podiatry or medicine or physio, are all very worthwhile careers, and hopefully there will be a lot more of them on offer in the University of Ulster Magee as the years go on. So if anybody wants any advice or help, feel free to contact me. But I mean, I suppose if you remember that the job that I do, and probably I have a wife, my wife's a nurse too. I mean, essentially, I don't ever think really of my job as a job per se. I've never really thought of it as that tough. I've always enjoyed it, and I think that's probably the key to the longevity of it, because if you can enjoy your job, then it doesn't become like a chore every day. Sometimes I feel like my job is that I get paid to speak to people, and it just so happens that at the end of this chat that I have to them, that I usually have to come up with some sort of decision, and sometimes even give them a treatment. But essentially in 20 years of general practice, you find that a lot of the patients become almost your friends. You certainly know them well. Whenever there's something wrong with them, you have an awareness of that. And certainly I would find that the job has got a lot easier as I've got a bit older, because I've become more aware of my surroundings. It gets easier to know how to go about and do things. So again, I mean, it's a very rewarding career, and I would encourage anybody to go into nursing or medicine if they were so inclined. And occasionally you'll hear people out there saying, "Don't be a doctor," or "Don't be a nurse." And what I would always say is that I would never let anybody's personal opinion about their own jobs put anyone else off a career in whatever it is that they had considered. Whenever I hear people saying that they wouldn't want to let their children go into nursing or medicine or teaching or anything, I always say, well, that person obviously has a problem with the job themselves. They need to sort out their own career. They need to sort out their working conditions. And once they sort those out, then maybe then they'll have a better appreciation about advising young people about their careers. But don't let anybody ever put you off doing what it is you want to do. Once you make the decision, just stick to it. All right, yours. I'm saying yours sincerely. Alright, God bless, good luck.